Bonjour, bon mardi à tous. Je suis Boris
Hello,
Proulx,
happy
journaliste
Tuesday. I am
parlementaire au
Boris
journal Le
Proulx,
Devoir, et
journalist for
bienvenue à
Le
cette
Devoir, and
conférence de
welcome
presse
to
de
today's
Karen Hogan,
press
la
conference with Karen
vérificatrice générale
Hogan,
du Canada,
the
sur
Auditor General of
les
Canada,
rapports déposés ce
on
matin.
the
I'm
reports
Boris
tabled
Proulx,
this morning.
reporter for Le Devoir, and welcome to this press conference with Karen Hogan, Auditor General of Canada, regarding the report tabled this morning. We will have a few remarks from the Auditor General, and then we will go for a question period. So if you are listening on Zoom, please use the raise hand function during the press conference, and we'll come to you after the questions in the room. Donc, si vous êtes sur Zoom,
If you are on Zoom, please use the raised hand function during the press conference, and we will give you the floor after the few questions in the room.
Here to you, here's to you, Auditor General.
Merci.
Thank you.
Bonjour et merci de vous joindre à moi.
Good morning, and thank you for joining me. I want to begin by acknowledging that we are gathered on the traditional, unceded territory of the Algonquin and Anishinaabe people. Today, I will be discussing the results of our two most recent COVID-19 audits. This brings to 11 the number of COVID-related reports that we have delivered since the onset of the pandemic in Canada more than 2 years ago.
The 9 COVID-19 audits we delivered in 2021 looked at the government's actions to respond to the pandemic and at whether federal organizations were prepared to deal with a large-scale public health emergency. With the audits we are releasing today, the focus of our work is shifting to look at how federal departments and organizations managed programs and services for Canadians as the pandemic continued to evolve. Our first audit examined how the federal government procured and distributed vaccines to the provinces and territories to immunize Canadians against COVID-19. In Canada, public health is a shared responsibility between the federal government, the provinces, and the territories. Dans l'ensemble,
Overall, we found that the Public Health Agency of Canada and Health Canada, supported by Public Services and Procurement Canada, work together to respond to the urgent nature of the pandemic. They obtained COVID-19 vaccines so that everyone in Canada could be immunized as quickly as possible. In 2020, Public Services and Procurement Canada established advance purchase agreements with 7 companies that showed potential to develop viable vaccines. Signing these agreements increased the chances that Canada would secure enough vaccine doses to support the largest immunization program in the country's history, recognizing that this approach also meant that Canada could end up with a surplus of doses if all vaccines were eventually approved. Health Canada adjusted its usual authorization process to speed up the regulatory approval of COVID-19 vaccines. Between December 2020 and May 2022, the federal government paid for 169 million doses of vaccines. Over 84 million were administered to eligible people across the country, and so by the provinces and territories. On average, the Public Health Agency of Canada delivered vaccines within 2 days of receiving a province or territory's request. This is successful considering the logistics of transporting temperature-sensitive materials to sometimes remote locations.
While the organizations involved were successful in securing vaccines and quickly distributing them to the provinces and territories, the Public Health Agency of Canada's efforts to minimize wastage were unsuccessful. By the end of May 2022, Canada had 32.5 million doses of COVID-19 vaccines, estimated to be worth about $1 billion in federal, provincial, and territorial inventories. Another 50.6 million doses were deemed surplus and offered for donation. We found that the agency's ability to reduce wastage was affected by delays in implementing important functionalities of Vaccine Connect, the information technology system meant to help manage COVID-19 vaccines. We also found that the Public Health Agency did not have finalized data sharing agreements with the provinces and territories. As a result, it struggled to effectively share detailed case-level safety surveillance data with Health Canada, the World Health Organization, and vaccine companies.
We raised concerns about the sharing of health data between federal and provincial or territorial health authorities in 1999, in 2002, 2008, and again in our 2021 audit of pandemic preparedness. These long-standing issues, including implementing a pan-Canadian framework for sharing information, must be urgently addressed because the sharing of health data is a cornerstone of effective surveillance to keep Canadians safe. I'm going to turn now to the second audit we released today. It focused on several COVID-19 support programs for individuals and also looked at the Canada Emergency Wage Subsidy, which provided support to employers. All these programs are measures that the government put in place to minimize the impacts of the COVID-19 pandemic on the health of Canada's population, businesses, and economy.
Overall, we found that the Canada Revenue Agency and Employment and Social Development Canada effectively delivered COVID-19 programs to provide quick financial relief to individuals and employers affected by the pandemic. In this way, they served to prevent an increase in poverty and income inequalities and helped the economy bounce back. In 2020, the government decided to rely on information provided by applicants and limit prepayment controls to expedite helping people and employers affected by the pandemic. In doing so, it recognized that there was a risk that some payments would go to ineligible recipients. We found that overpayments of $4.6 billion were made to ineligible individuals, and we estimated that at least $27.4 billion of payments to individuals and employers should be investigated further. The Canada Revenue Agency and Employment and Social Development Canada recognized the need for increased post-payment verification work with the early decision to limit prepayment controls. As the pandemic continued to evolve, the post-payment verifications were delayed. The number of post-payment verifications included in the plans is insufficient to address all payments at risk of being ineligible. The agency and the department are not planning to verify payments made to all identified recipients who may not be eligible for COVID-19 benefit programs.
Efforts to collect amounts owing have been limited to date and focused mostly on prompting voluntary repayments. As of this summer, the Canada Revenue Agency had recovered approximately $2.3 billion. I am concerned about the lack of rigor on post-payment verifications and collection activities. The Canada Revenue Agency and Employment and Social Development Canada need to act now to expand their post-payment verification plans to include all recipients identified as being at risk of being ineligible for benefits. Then the department and the agency need to carry out their plans and recover COVID-19 benefit amounts owed.
The pandemic prompted the creation and delivery of income support programs never seen before in Canada. Many were up and running in a matter of weeks, where normally it would have taken months or even years. Though government organizations knew in 2020 that they would need to undertake significant post-payment work down the road, They have not adjusted their resources or plans to deal with the long-term effects of vast income support programs that were rolled out in record time. Billions of dollars have gone or may have gone to ineligible recipients. To preserve the integrity and fairness of Canada's tax system, the government is required under current legislation to take action. If it chooses a different approach, then it must be clear and transparent with Canadians. Je vous remercie de votre attention.
Thank you for your attention. I am now ready to answer your questions.
Thank you. Merci. If you are attending on Zoom, please use the raise hand function at this point to ask a question. Mais nous allons d'abord commencer par les questions.
We'll start with questions in the room. We'll start with Nojoud Al-Malit from La Presse Canadienne, from the Canadian Press.
Hi. My first question is about the report on the COVID benefits. I'm wondering if you could compare a little bit the benefits for individuals versus businesses. Which do you see were more successful in their delivery and also verification and just as a whole?
So when it came to the benefit programs, we found overall that they were quite effective in meeting the government's objectives of first getting support out to individuals and employers quickly, minimizing the increase in poverty or income inequalities, and also helping the economy bounce back from the pandemic. So that would lump in both the individual and support to employers. When I divide them up throughout the pandemic, what we saw is that the government tried to adjust and add some additional prepayment controls and made modifications to the programs linked to individuals, but really missed those opportunities when it came to the business support. What we found is that even though the program kept getting extended for the wage subsidy, there was no addition of prepayment controls, which would have minimized the need for rather lengthy and complex post-payment work related to businesses. When it comes to recovery, I think that was the last part of your question, I would say they're at such early stages in both individual and employers that it is too early to tell. That's why we recommended much more rigorous plans. That was the commitment that both of the departments made following my first audits in 2021, that they would put in place comprehensive post-payment plans, and we're just not seeing that happen right now.
Mm-hmm. Thank you. And my follow-up question is about the other report. This is on behalf of my colleague, but she's wondering if you could be a little bit more specific about, how to prevent wasted doses in the future.
Mm-hmm. Well, there's been many recommendations following H1N1 and SARS, and even the first report I released on pandemic preparedness that talked about the need to not only resolve data sharing agreements across provinces and territories to have a more timely and informed response, but also to have the technology needed to support that. Vaccine Connect was something that was put in place during the response, the rollout of these COVID vaccines, which really, they could have had a better system in place earlier. If they had implemented all of the functionalities of Vaccine Connect, that could have helped identify supply needs and when vaccines were likely to expire and move them around more effectively, which would have minimized potential wastage.
Thank you. The next question is Louis Blouin, Radio-Canada.
Bonjour.
Hello. You said that you're concerned by an amount of $27 million for benefits. That's a lot of money. Could you explain what should have been done in following up to ensure that these funds were well spent or that they are able to be recovered? And is it too late to recover that money? You talked about 36 months. That's not a lot of time. Is it too late to recover those amounts? Answer. We noticed that there were overpayments of $4.6 million for people who were not eligible. The follow-up is being done now by departments, and we believe that there's about $27.4 million that needs to be investigated, where the post-payment verifications need to be done by the government. We identified indicators that certain individuals and businesses were not eligible for the amounts that they received. What concerns me is that the plans are not exhaustive. They don't include all activities, and they don't include a follow-up to see if individuals and businesses are eligible. We need to start there and see if recovery is needed afterwards. Currently, in the legislation, there is a time frame for individuals of 36 months if there isn't any misinformation that was shared, and for businesses, it's about 36 to 48 months. And that's why I was expecting that post-payment activities would start, and we recommended that they should be more exhaustive before that deadline. For vaccines, you've said 30 million doses were wasted. That was at May 31st. According to you, do you believe that that number will increase significantly? You've noted that there are many doses that have been stockpiled that will be expiring by the end of the year. So will this number increase significantly? Answer. That is a question that I asked the Public Health Agency of Canada. I asked them to tell me what happened with the doses following our audit. The department confirmed that there are 11 million doses that have expired. And so the number of doses that have not been used could expire even with the doses. Inaudible. That's why we recommended that Vaccine Connect should be implemented in order to better manage vaccines and to minimize waste in the future.
Merci. Next up, Ryan, National Post.
Yeah, hi there. On vaccines, I'm wondering overall, you've talked about some of the logistical issues and the tracking, et cetera, that government could have done better. But having ordered 7 different vaccines and tens of millions of doses in advance, was this level of wastage unavoidable once all these vaccines were delivered and worked as well as the government expected, I guess?
I mean, it's a great question now to sit here and look back and think of what happened, and I would invite all of us to try and put ourselves back in March of 2020 and the environment that was going on then when the government entered into advance purchase agreements. There was a global rush to develop a vaccine. No one knew which vaccine companies would develop viable vaccines, which would then be approved for use in Canada. There was a large global demand where Canada doesn't have any manufacturing capabilities for those vaccines. So in my view, the approach that the government took to enter into advanced purchase agreements was a prudent one. They knew that that would result in excess vaccines or surplus vaccines being available, which is why there was a commitment to make donations. But there again, so many countries were trying to donate, and that market saturated, resulting in the Canadian government not being as successful as they could. But in my view, it was a prudent approach given all the uncertainty back in 2020, and now we're able to look back and see the results of those decisions.
Okay. Just a follow-up for a colleague. In terms of the overpayments of the CERB and other benefits, do you have an estimation of how much of those overpayments are the result of sort of good faith mistakes by Canadians and how much are fraud? And do you have an estimate of how much you think the government can realistically expect to recover from that process?
Unfortunately, I can't give you an answer to either of those questions because of the limited information that's available at the Canada Revenue Agency right now. When it came to individuals, the 2019 and 2020 tax returns are now available. They weren't available earlier on, which is why we've identified some payments that require further investigation that I feel pretty confident are ineligible, but in order to really give, take the more prudent approach of giving the benefit of the doubt to the taxpayer, we've identified them as needing follow-up. When it comes to the businesses, there was very little information that was collected on a monthly basis. And so without post-payment verification, it would be almost impossible to know the ability to recover or not, or even to identify with greater certainty what went to ineligible businesses, which is why much more rigorous post-payment work is needed from the government.
Thank you. Next up, Bill Curry, Globe and Mail.
Hi, thanks for taking our questions. To follow up on the $27 billion, one of your recommendations is the government should more aggressively pursue that, and you describe it as a minimum amount, that it could be more than that. The government's response is that they only partially agree to that recommendation, and they make the argument that it is likely not cost efficient to go after all of that money. So what is your reaction to their response to that?
Well, I obviously stand by my recommendations, and I base my recommendations on two things. Following our 2021 audit on the Canada Emergency Response Benefit and the Canada Emergency Wage Subsidy, the department's committed to rigorous post-payment work. And so I was expecting to see that happening now, and it is just not happening to the degree that I believe it should be, given the very limited prepayment controls that were used at the start of these programs. The second is I would point to existing legislation that requires that every Canadian taxpayer be treated fairly, and that if an individual or business receives something they're not entitled to, it should be returned. So our expectation is that anyone who has a high indicator of potentially being ineligible should be investigated further. The decision then about recovery is one that I encourage the government to be transparent about what they decide to do. If they want to perhaps forgive payments or take a compassionate approach, then they should just be clear and transparent with all Canadians what to expect.
I think from memory, it's pretty unusual for a government to not fully accept a recommendation. I could be wrong on that, but in the back and forth, had they at any point rejected outright that recommendation? Can you kind of talk about the back and forth that went into that?
No, so I think most departments like to agree to our recommendations. I'm not sure that their written answer then supports that agreement, but that's another issue for us to deal with. Here, the back and forth that we had was very clear. They felt that they didn't have the resources or the ability to follow up with everyone identified as ineligible. But again, I base it on fairness to all taxpayers. I'm sure there are individuals out there who are wondering, will I be asked to repay? Will I be able to repay? And that's where I encourage that their plans should just be made clear to Canadians so that every individual and business knows what to expect.
On va passer à Raphaël Pirot, Agence QMI.
Raphaël Pirot, Agence QMI. Yes, hello. I would like to know if there's a minimum amount that we're certain to have lost. So funds that were overpaid that will never be able to recover. Answer, this is a question that I won't be able to answer. I don't know of an individual's or a company's capacity to refund funds. There were $4.6 billion that were sent to recipients that were ineligible. For the $27 billion, that's a minimum amount because there are other eligibility criteria that we were not able to verify. And that's why the government can only identify the sums if they do a vigorous post-payment assessment. Second question, there's a big difference between $5 billion and $27 billion. How can that be explained? For the $4.6 billion, those are payments to individuals at the beginning of the pandemic that were paid, that were duplicated rather. People were supposed to receive one benefit at a time, and there was a little bit of confusion at the beginning. individuals were sending an application to ESDC and to the CRA, and they received 2 payments. And those are cases that absolutely need a follow-up. For the rest, it's estimates or information that is missing at the CRA. So that's what's left from all the other programs.
Global.
You've said that the programs, or the money programs, were effective in meeting the government's objectives. But considering the amount of money that's kind of unaccounted for here in terms of whether or not it was appropriately paid out, do you think the programs themselves were effective?
Mm-hmm. So we concluded they were effective in meeting the objectives, which I would summarize high level as getting funds out quickly to individuals and businesses, minimizing an increase in poverty or income inequalities across the country, and also allowing businesses to maintain that relationship with their employees and rebound once the economy reopened. That was effective. There's lots of statistics in our report from Statistics Canada that demonstrate them. I would argue that they were inefficient in that the decision early on to limit pre-payment controls, knowing that there would be payments made to ineligible individuals, has now resulted in billions of dollars going to ineligible individuals or potentially going to ineligible individuals. And that's why the hard work is now needed when you minimize prepayment to do rigorous post-payment work to identify who is really ineligible and then make decisions about recovery.
Just in English, similar to my colleague's question, it is a big gap between 4.7 and 27. Why is there such a wide gap there from your perspective?
So the $4.6 billion that we identified that was to ineligible individuals really relates to the start of the pandemic, where mostly I would assume because of confusion, individuals applied to both the Canada Revenue Agency and Employment and Social Development Canada to receive the same benefit for one period. So all of the individual income support programs, and individuals only allowed to receive one benefit per period. So that doubling up is the $4.6 billion for the most part. The rest, we're talking about all the other COVID programs as they continue to go on versus just the first few months of the pandemic. So that explains the large difference in the 2 buckets of funds that we identified.
Dernière question dans la salle.
Last question in the room, Antoine Trépanier, Le Droit. You talked about a lack of rigor in recovery. Were you able to identify the cause for that? Is it because of the governance structure or because of the systems in place? Is it the public servants who did not do their jobs correctly? Have you been able to identify that lack of rigor? Answer. Firstly, the plans are not exhaustive. They don't contain all of the activities and don't include activities to see if all payments having a risk indicator are going to receive a follow-up. That's where there's a lack of rigor. We asked that question of the CRA, and they confirmed that delays were caused by the pandemic. And that's why we recommended that they do more work soon because of the time that they have to identify if payments were made to ineligible recipients. Those 2 departments that you mentioned in the report, that's where there was a lot of change in staff, a lot of new hires. Could that have played a role in the dynamic and in the results? Answer. We didn't look at the individuals or resources at the departments. I believe that having an exhaustive plan would have helped them determine their needs for resources and time. That's why you need a comprehensive plan. But we did not look at public servants and capacity specifically. Thank you. We're now going to move to questions on Zoom.
Questions on Zoom. We have quite some time, so that's good. We're on course to answer them all. First up, Émilie Bergeron de La Presse Canadienne.
Oui, bonjour. Pour continuer dans la même veine que
To
mon collègue
continue
Antoine Trépanier, sur le
on
manque de
the same
rigueur,
question as my colleague
qu'est-ce
Antoine
qui aurait
Trépanier
été
on
une
the lack of
approche
vigor? What
en amont
could have
qui
been
aurait
an
eu plus de
upstream
rigueur selon
way of
l'étendue de
doing
votre analyse?
things
Qu'est-ce qui aurait été une
that
façon de faire qui, dès le départ, là, aurait eu plus de rigueur?
would have increased the rigor?
Je suis encore de l'avis que la décision prise au début de la
Again, I believe that the decision made at the beginning of the pandemic
une des meilleures pratiques
to
internationales
follow
de minimiser
some
les
of the
contrôles
international
préalables au
best
paiement dans le
best
temps d'une
practices
urgence est encore une bonne décision. Mais
was
cela vient
a good
avec
decision,
le besoin
but that comes
d'avoir
with a
beaucoup de
need
rigueur
to have
post-paiement.
a lot of
J'aurais
post-payment
aimé voir que
verifications.
le gouvernement serait
I would have
ajusté
liked to see
pendant que la
that
pandémie
the
continue.
government,
Il y a eu beaucoup d'opportunités
I
manquées
would have liked for them to have made
quand,
adjustments
par exemple,
during the
subvention
pandemic.
salariale
For
a été
example, when the
étendue à
wage
plusieurs
subsidy
reprises, ou
was
suite à
extended
notre vérification
multiple
en
times, or
2021,
following our
de
audit
mettre
in
en place plus de
2021,
rigueur
they could have
préalable au paiement.
implemented more
Avec
vigor before
moins de rigueur là, il faut
payments.
vraiment avoir un plan plus exhaustif. Et je
Because
m'attendrais
without
que
that
le
vigor, there needs
ministère
a
utilise
post-payment
l'information
plan that is more
qui était dans leurs
exhaustive.
mains, liée aux déclarations de TPS et
They
toutes
had
les autres informations
information
que l'Agence de
on
revenus avait dans leur possession pour identifier des
GST
paiements
in order
à
to
risque d'être
identify
inéligibles. En ce
payments
moment,
that
leurs
were
vérifications
possibly
planifiées sont très
ineligible.
minimes, presque semblable au taux de vérification qu'ils font dans un programme habituel où il y a beaucoup
They have
de
similar
contrôles préalables au paiement.
verifications
Et je m'attendais
in
vraiment
other
à avoir
programs,
beaucoup plus
and
de
so I was
rigueur
expecting
post-paiement cette
to
fois-ci.
see more vigor this time.
En suivi, sur
A
l'autre
follow-up
l'autre
question
audit, celui sur les doses
on
de
the other
vaccins qui ont été
audit
perdues,
on
vous
wasted
avez parlé de
doses.
problèmes
You
liés
talked
au
about
système
problems
d'échange de
linked
données
to
entre le
the
fédéral et les
data sharing
provinces.
system between the federal
Vous dites
government
que
and the
c'est un problème qui
provinces.
n'est pas nouveau,
You
que
say that
ça
this
fait
problem
depuis
is not new,
1999 que c'est un
that it's been an
problème, que
issue
c'est
since
urgent d'y
1999,
remédier.
that it
Alors, est-ce que ça
urgently
bloque
needs to
vraiment
be
du côté
fixed.
de l'Agence de la santé
So,
publique du Canada
is it
pour
caused by
rétablir ce
the
système de
public
partage de données?
safety
Et si ça bloque de ce côté-là, là, du
department
côté
in
du
Canada?
fédéral, où exactement dans le processus ça bloque?
Where is the problem
Alors,
in the
je ne pourrais pas
system?
vous dire si c'est vraiment le gouvernement
Answer.
fédéral ou toutes les autres
I wouldn't be able to
niveaux
tell
de
you
gouvernement.
if it's the federal government
Comme vous le
or
savez,
other levels of government.
la santé est vraiment une
As you know,
responsabilité partagée
health
entre
is a
tous les
shared
niveaux,
responsibility
des
between
gouvernements.
the different levels
Et
of government.
le manque d'une entente pan-canadienne
The lack
pour
of a
partager de
pan-Canadian
l'information est
agreement
vraiment
to
quelque
share
chose que
data
ça fait plusieurs années, presque 25 années,
is something
que nous autres, comme
that
bureau, l'avons
we
identifié
have
comme un
raised
problème.
for over
Et je me
25
questionne
years
combien
as an issue.
d'autres, d'urgences sanitaires qu'il faut
And I
qu'on
wonder
passe à travers comme
how many
pays avant
other
qu'on
health
puisse
crises do we
trouver
need
une
as a
solution
country
à ce
before we find
partage-là
a
qui
solution to that
améliorerait
data
non
sharing.
seulement tout notre système de santé ici au Canada,
We need to improve our
vie des Canadiens.
health
Et
system
alors,
in
c'est
Canada
pour ça que j'ai fait
in
une
order to help
recommandation pour
Canadians, and that
encourager
is
le gouvernement
why
d'aller de
I made a
l'avant,
recommendation
pour
for the government
conclure
to move forward
l'entente pan-canadienne
and
de partage
conclude the
d'informations.
Pan-Canadian Data Sharing Agreement.
Merci. Question suivante, Mylène Crête de
Following
La Presse.
question, Mylène Crête, La Presse.
Bonjour. Justement,
Hello.
concernant le partage de données
With
avec les
regards
provinces, je me demandais,
to
est-ce
the
que vous
data
savez
sharing with
comment ça se
provinces,
passait avec le Québec?
I was wondering if you had any information on
Non, pas du
data
tout.
sharing with
Je ne peux
Quebec.
pas vérifier ce qui
Answer.
se passe avec toutes les
I
provinces.
cannot
Vraiment, j'ai
see
vérifié
what
du côté du
happens
gouvernement
with
fédéral.
the provinces.
Et
I only
ils
looked
n'ont
at
pas
the
cette entente-là, et
federal
c'est pour ça que
government,
j'ai fait une
and they don't
recommandation
have an
au
agreement,
gouvernement
and that
fédéral
is
d'aller
why
de l'avant
I
avec
made
leurs travaux
a
sur ce
recommendation
sujet.
to the government to work on
OK,
that.
donc vous constatez qu'il n'y a pas d'entente, mais
So
on ne
there
sait
is
pas
no
après
agreement,
comment ça fonctionne dans les négociations avec les
but
provinces.
we
Ma
don't have
deuxième question,
information
c'est
on how it's going with the
concernant
provinces.
l'Agence de
My
revenus
second
du
question
Canada,
has to do
elle a
with
annoncé
the
la semaine dernière
CRA.
qu'elle voulait recouvrer
They announced last
3,2
week that they
milliards
wanted
de
to
dollars de
recover
prestations versées
$3.2
en
billion
trop.
of
Est-ce
overpayment.
que, à l'aube
Overpayments.
de l'année 2023, il est trop tard, vu le
Is
délai
it
de
too
36
late
mois, pour
because of that
récupérer ces sommes-là?
time frame of
À mon avis, il
of
reste
32
encore du
months?
temps pour
Answer.
identifier
I think that
les
there's still
paiements qui
time
sont faits à des
to
individus ou des entreprises qui sont
identify
inéligibles. Et après, la
overpayments
question
or
de recouvrement
ineligible
est
payments
une que
to
le
individuals
gouvernement
or
peut faire
businesses.
une fois qu'ils ont identifié
And once the
les
government
individus ou les
has
entreprises. Il reste un peu de
identified
temps,
these people, they could recover
parce que tous les paiements n'ont pas été émis
the
au début de
amounts,
2020.
because not all
Et je
payments
leur
were sent
encourage
out at the beginning of
vraiment de
2020.
débuter ce travail
So I would
de
encourage them
recours.
to start this
Juste,
work.
est-ce que vous savez combien de temps il resterait?
Do you know how much time they have left? Answer, not with any certainty, but I think that the first payments were sent out in April 2020, so 36 months is
Next up,
coming shortly.
CBC. Can you hear us,
Hello.
JP?
Can you guys hear me?
Yes, go ahead.
You can? Okay, awesome. Yeah, so you said in your conclusion that you're expecting significant unrecoverable amounts are likely to materialize with respect to the benefits that were paid out. Why have you come to this conclusion? Why aren't you confident that the government will claw back all the money that was paid out to ineligible people?
So I think I ended my closing remarks with there's a possibility that be the case. The government needs to first, according to the current legislation, identify and notify individuals, and there is a legislative limit to that time frame in order to be able to notify individuals and businesses if they have received amounts that are ineligible. My advice to them is if they wanted to make a decision then about recovery, one that might either forgive payments or be empathetic, then that's something they should be clear and transparent to with Canadians. But current legislation would require them to follow up with those individuals and recover those amounts.
And you mentioned in the report that there's actually relatively few cases have been referred to the authorities, to the police, for fraud or identity theft. Do you think, is it fair to say that there was likely a lot more criminality around these programs that has just gone undetected?
Unfortunately, I could not confirm that. Again, a lot of information not being collected at the beginning of the program it leads to the need for post-payment work to confirm eligibility factors. When we did see instances where there was potential fraud, we ensured that the agency had either taken proper action or referred them to the authorities and didn't do any further work in order not to get in the way of that investigation.
We will go to Alex Bellingal, Toronto Star.
Hey, thank you very much. I just wanted to circle back on something you mentioned in French. I think it was to Louis' question earlier about vaccine wastage since the end of May, I guess from the inventory of 32.5 million that was sitting in various government inventories. Was I correct in hearing that you said another 11 million have since expired? And if so, do you have an idea of what the size of that inventory is now as we're a few weeks away from the end of the year?
So this is where I should have put my glasses on when I answered the first question to be accurate with you. Those were donated. I think the question there was about donations originally. So an extra 11 million had been donated after year end. So my apologies if I did misspeak. Expired afterwards, not after year end, after the end of our audit, which was May. There was an additional, I would say about 10 million or so doses that have expired since. And this is exactly why we recommended that Vaccine Connect needs to be put into place and its full functionalities be used. We even pointed to some of the data really not being very solid data and having errors in it. As the country continues to buy doses, whether they be bivalent doses or others, it makes sense to have a better handle on where the inventory is and better management controls to avoid minimizing wastage in the future. But there is some doses both included in inventory and those available for donation that have since expired since the end of May.
Okay, thanks. It was probably my French, maybe not your mistake, although the transcript will tell, I guess. But an additional 10 million basically expired. So we're talking about, 23.6 million doses expired. I guess in terms of the donations, I know the report kind of touches on this. I'm wondering if you can expand on this. What did you learn about the difficulties the government has had in actually, with these surplus doses that are sitting there, donating them to other countries that need them?
Well, the Canadian government, like many governments, made a commitment to donate certain doses to foreign countries. There were some logistical complications in trying to do that. The age, the shelf life remaining on some of the vaccines at times caused some difficulties, but really the biggest was the saturation of the donation market. So many other countries were donating that Canada just couldn't ship all the ones they intended to ship.
Thank you. Next up, Chris Nardi, National Post.
Good morning. I'm just wondering, as you know, CRA has been doing audits and verifications for the better part of many decades now, and arguably has a lot of experience in that. So I'm wondering if you were surprised when you were going through their process and their post-verification protocols, surprised by how disappointed ultimately I read that you are in how, lackluster or not very thorough that they are. Was that surprising to you, considering the agency's experience?
Well, I think the pandemic is really an unusual time, and the responses require an unusual level of work. So what we found was that Canada Revenue Agency was taking its typical approach of a risk-based and sampling, and in our view, that is just not rigorous enough when you have such limited prepayment controls. And I think this is why two of our recommendations are really key in the audit about the government advancing its plans and projects to have real-time revenue and real-time payroll information systems available going forward. Not only would this just improve the integrity of Canada's tax system and have better information on hand, it would improve the efficiency and effectiveness of any future income programs that might be needed should the country have to go through a similar health emergency in the future.
And just to circle back as well to Bill Curry's questions on the kind of semi-agreed upon recommendation, CRA says basically it wouldn't be particularly efficient to try to go and recoup every single dollar that was overpaid, whereas you say, well, you should at least make, a strong effort to get as much as you can. Do you get the sense that the agency is just trying to kind of set the bar relatively low so that it can't disappoint, as opposed to actually make the maximal effort and get the maximal recovering?
Unfortunately, I can't tell you really what the agency is thinking when they decided to partially agree with my recommendation. I'd encourage you to ask them. My job is to hold them responsible for delivering programs within the current legislation and within what I believe are the best practices. When you have limited prepayment controls, you have rigorous, comprehensive post-payment work that is needed to verify eligibility.
Last question that I see on Zoom. So if you are listening on Zoom and want to ask a question, it's time to use the raise hand function at this moment. So last question is Palak Mangat from Politics Today.
Hi, Ms. Hogan. Thanks for taking our questions. In sort of the early days of the pandemic, there was a lot of talk around the cost of individual vaccines, and the government often said that, it couldn't specifically say because of commercially sensitive info, and that it could hinder their ongoing or future negotiations with other manufacturers. Can you speak to whether or not that's something you came across too? I know that the average cost for vaccines in your report is listed at about $30, but that's as of May this year. So I'm just wondering whether or not there were other estimates that you had, or do you think those numbers maybe fluctuated dramatically?
So throughout our audit, we actually had access to all of the advanced purchase agreements and amendments to them, but we too have to respect the confidentiality clauses that were included in those contracts and can't provide a lot of details about the vaccines and the vaccine costs. But I knew that Canadians and parliamentarians would want to have an idea of the estimate of the cost of a vaccine. And so what we did was use information that was publicly available, so all of the payments to vaccine companies through the public accounts of Canada, and then the 169 million doses that we saw the government had paid for during our audit period. So I can tell you that I'm confident it approximates the average cost of all the doses that the government has paid for, but I would caution that that's at a point in time. As more doses are received, that number can fluctuate up and down. Foreign exchange will play a factor. So it really is just to give sort of a benchmark to individuals on the average cost of a vaccine as of May of 2022.
Thank you.
Okay, and
Excuse me, go ahead for your other question, Palak.
Yeah, sorry, just as a follow-up, and I don't want to be sort of alarmist here, just I guess moving forward for future emergencies or in case of the future pandemics, does the nature of these negotiations or maybe the lack of some information make it difficult for you or governments to kind of hammer out which companies are, the best or maybe most cost-effective ones? Yeah.
Well, I don't think it's unusual to have such confidentiality clauses in the pharmaceutical industry. But, these were really unusual times. And what was going on in 2020 is something that really had never been seen, the global demand, the global race to find a vaccine. And so all of those played into, the factors that ended up being terms and conditions of these contracts. But I was not hindered. My office had full access to all the information.
Merci. Il y a plus tout le
Thank
monde
you.
l'occasion de poser une question.
Everyone had the opportunity to ask a
A
question.
short one of questions since we have some time left, if it's okay with you, Madame Vérificatrice Générale.
C'est vous qui contrôlez l'heure, oui.
I'll start with
You control the time.
myself. Concernant les Boris Proulx du Devoir, concernant
I'm Boris Proulx from Le Devoir.
vos calculs du 27
For your
milliards de dollars,
calculations on the $27 billion
donc suspecté d'être inadmissible,
that is
c'est pas clair du
probably
tout,
ineligible,
parce que dans vos
it's
calculs,
not very
en page
clear
23, je
because
crois, de
at
votre
page
rapport,
23 of your
vous
report,
détaillez
you
pourquoi les montants
give
sont
details
inadmissibles.
as to
Donc,
why these amounts are
est-ce que,
ineligible.
selon vous, on peut carrément
Do you
parler
believe
de
that
8,3 milliards de dollars versés à
we could talk about
627 000 bénéficiaires
$8.3 billion
inadmissibles,
sent
3,8
to
milliards
ineligible
versés à 1,4
recipients,
million de bénéficiaires inadmissibles, 15,5 milliards à des
15.6
entreprises
billion
inadmissibles.
to
Pourquoi vous faites cette distinction
ineligible companies? Why do you make
Pouvez-vous m'expliquer
the
un peu?
distinction? Can you explain it, please?
Parce qu'on a détaillé le calcul un peu pour
We
démontrer que
detailed the
c'est un peu
calculations to
complexe et
show
qu'il y a un
that
manque d'informations
it's
à
complex.
l'Agence de revenus
There's
du
a
Canada
lack
pour
of
qu'on puisse
information at the CRA
avec certainté
for
que
us
c'est des montants
to
qui ne sont
conclude
pas
with
admissibles.
certainty that these amounts are ineligible. For individuals, they would be eligible if in the 12 months before the application that they had received $5,000 in income. But tax returns are on a calendar year, and so the information salary per month is not available. And that is why we recommended that having a system with real-time information would be very useful for the future. For businesses now, as I mentioned, there was no information collected by the CRA on monthly revenues, and this information does not exist at the CRA except for sales taxes. And again, that's only businesses that share that on a monthly basis. So there's a lack of information, and that's why we say that these are high-risk indicators and the government needs a more in-depth follow-up. In the government's response, they say that the high-risk indicators were verified, but what you're saying is that there are other high-risk indicators that were set aside. The GST, for example. Answer, yes, because we looked at all of the businesses that send in their provincial tax sales on a monthly basis. We believe that the government sample is too small, and that is why we recommend a more exhaustive approach for post-payments.
A few extra questions. I saw a little fingers. I'll start with Bill, perhaps, from Global Mail.
Just want to follow up. You made a comment saying if the government wanted to waive payment obligations for reasons of empathy, they should say so. if the government went down that road, because presumably when you look at your report, a lot of the people who receive these benefits are some of the lowest income people in Canada. Some are ineligible because they didn't even have 5,000 in income, the threshold, according to your report. So if they were to make that argument, what would your take be on that?
I'm not the one who sets law or makes those kind of policy decisions, but I absolutely think it would be a reasonable approach. But I encourage them to be clear with Canadians. Right? I think one of the greatest things about our country is you can expect fairness and transparency, and I'm just asking the government to be clear with its decisions and its approaches to Canadians. Right now, the legislation would require them to follow up with every individual and business that is ineligible.
Follow up on the wage subsidy. The report breaks down by size of company. And there's a pretty sizable percentage as 5 employees or less. Are you trying to signal anything by breaking that down? Were you more concerned about particularly small companies, or is any section more high risk, I guess, of?
No, not at all. I think what we were trying to demonstrate, there's a lot of demographics in the back end of our audit report, was to show that individuals and businesses that needed support the most received it. Now it's about identifying if there are those that were ineligible for the benefits and making a decision about recovery. So it was really just to help everyone understand where the funding went, whether it was across provinces or across sizes of businesses.
Louis, en français, and then Ryan.
Bonjour, Louis Blouin,
Hello, Louis
Radio-Canada.
Blouin
Quand
from
vous voyez ça,
Radio-Canada.
des dizaines de milliards de
When you
dollars
see
dépensés,
tens of billions
peu
of
de
dollars
suivi
spent and very
ensuite
little
pour des
follow-up
remboursements. Question
for
très simple,
recovery.
est-ce que c'est de la saine
Simple
gestion de
question,
finances
is
publiques, ça,
this
pour vous? Est-ce que c'est
proper
digne d'un pays du G7?
management worthy of a G7 country? Answer. In normal times, I would say no, but we are not in normal times. The approach at the beginning of the pandemic was very new. The government was or had an approach that was different, and they need to have a different approach for their follow-up now as well, for sound public fund management. If they decide not to recover these amounts, it's up to them, but they should be clear and transparent to Canadians.
I'm just wondering as well, the government has made additional vaccine purchases probably since your audit, the bivalent boosters and things like that. Were you able to look at those contracts on a go-forward basis to know if the government is putting better controls in place so there won't be more wastage going forward? Because we know there hasn't been a big take-up, for example, in bivalent boosters compared to Canada's population.
So unfortunately, I can't talk about the terms of the contracts that we did look at. They're all within the 7 that we examined. I think the way to control wastage and to better monitor take-up would be to really implement all the functionalities of Vaccine Connect. The goal was to ensure that every Canadian who wanted to be vaccinated could have access to vaccines, and that was achieved. Now it's about minimizing wastage and better inventory management going forward.
And you may not be able to answer this one, but you talked about, you've seen the terms and conditions. Most Canadians have not seen the terms and conditions. Are you satisfied that we paid reasonable prices for the vaccines? Were we paying prices that were equal or equivalent to what other Western countries paid?
So it's a difficult question again to answer. If you go back to what the market looked like back in 2020 when the negotiations had to take place, as I mentioned earlier, no one knew which vaccine companies would be successful. No one knew which vaccines would be ultimately approved for use in Canada. Canada did not have manufacturing capabilities for these vaccines, so all of those factors played into the prices that were negotiated. When it comes to comparing to other countries, again, very difficult. Most of those countries, one, have not made those prices publicly available, but likely had manufacturing capabilities, and so you would expect that they would pay a different amount than a country that did not have access to vaccines so readily.
Chris from National Post on the line from a very last question, and then JP Tasker from CBC, and that will be it.
Ms. Hogan, I just wanted to circle back to the tables towards the end of your report. So you talked about obviously the $27-odd billion that you said CRA needed to investigate even more, but then in the tables at the end, you seem to have supplemental amounts on top of that you say should also be investigated, but are even excluded, from what I understand, from the $27 billion. And that includes like $1.2 million in CERB payments to dead people, or the $6.1 million to people who were incarcerated when they received it. What's the distinction there? Why aren't those amounts in the should be investigated? Like, not suspicious enough? What is it exactly?
Well, that's exactly why the statement that I made was that we've identified at least $27.4 billion in payments to individuals and businesses that require further investigation. There are other elements, as you say, in the back where we talk about each individual program. There we were just missing too much information to either have an audit level confidence that we should put them in the $27.4 billion, or we couldn't really quantify them in a good way. So again, it's about missing information, and that's why post-payment verification is really the only way to confirm the actual amounts paid to ineligible individuals, and that's why we recommended much more rigorous work is needed.
JP from CBC.
Yeah, I had a very similar question to Chris there. I want you to kind of talk about that 27.4 billion figure. It seems like it's a minimum, right? And then there are other sections that you just couldn't. There's other potential cases of overpayments that you didn't include in that figure. Can you just kind of speak to why those weren't included, and maybe how much they could be worth?
Again, it was really the uncertainty around some of the amounts and the missing information. So, for example, an individual who died during the year would have been eligible for payments up until their date of death. And so there is some information that we didn't have during our audit in order to make good conclusions, right? So that's why we triage them into different buckets. Those that we have a lot more confidence are included in the 27.4 billion. And then there is further follow-up needed for other amounts, both on the individual and business front.
Thank you.
Merci beaucoup. Merci à tous. Ceci met fin à la
Thank you,
conférence
everyone.
de
This
presse.
concludes
Thanks
today's
to all
press
for your
conference.
great discipline. We've been through a great amount of questions, so that is how it should be. Merci à Madame la Vérificatrice Générale. Et sur ce,
Thank you to the Auditor General. Have a good day.
Recording stopped.